This is Cox San Diego Connection. Welcome. Today we'll be talking about a subject that has been discussed quite a bit in the past few months, healthcare. You've probably heard about the Affordable Care Act, also known as Obamacare, and you're probably familiar with the term Covered California. In the next 30 minutes, we hope to give you some clarity, help you understand how it's all taking shape. Our first guest is here to discuss Covered California, our state's program that is insuring thousands of people. He is Dana Howard. Dana, thanks for being with us. Summarize Covered California for us.
Well, Covered California is the Affordable Care Act. A lot of people say Obamacare, but it is California's implementation of the Affordable Care Act, literally going to bring millions of people access to affordable health care coverage.
You were calling it a game changer. Why use that term here in California for people who don't have insurance?
Well, because for so long, people have not been able to have access to affordable, quality health care coverage. And if they did, they were subject to the whims of the insurance companies, whether they were going to say you're going to be denied because of a pre-existing condition, which in some cases has been something as so simple as a seasonal allergy. Or they have been beholden as far as how much they're going to pay. Rates going up on average 15 to 20% per year, and for many people, a whole lot more. Well, Incomes Cover California, and we're going to be able to, we believe, change much of that. Pricing, we think, is going to be more stable. There are health plans that have to bid to come into Covered California, and not everyone can get in. Not all the health plans can get in. We go out and we are what's called an active purchaser, meaning that we're going to go out and select who we believe are offering the best value for the consumers. So that when consumers come onto Covered California's website, coveredca.com, when they get there, they're not going to be deluged with 30 or 40 different healthcare companies to choose from, and then within them, 15 to 20 different plans. In California, we have 11 healthcare companies. In the San Diego area, there's 7, and so people will be able to go in and really make an informed decision, know that the benefits are going to be the same from plan to plan to plan. Whether it's Kaiser or Blue Shield or Sharp, it's going to be the same benefits. The only difference it's going to be is how much it's going to cost, and is the doctor and the hospital that I want to go see or visit in that particular plan.
How is the registration process coming along here in California?
It's going very well. A lot of people get confused with what was happening with the federal government. The federal government's getting their site together. They had some real obstacles because they had 34 states that they're trying to pull together, and not a one of them were being really cooperative in making sure that the Affordable Care Act got implemented within those states. But California has its own state-run exchange. That's what Covered California is. And so our registration, our enrollment has been going quite well, as a matter of fact. I mean, in the first month alone, in October, we were up to more than 30,000 people who had selected a plan. By November, end of November, it was up to 100,000 people practically, and that pace has kept going since.
Wow. How can people register? How can people enroll, especially if they have some questions and concerns about Covered California?
It's really simple. I mean, there are so many ways for them to get access. One, coveredca.com. That's the place to go to. It is the only website for consumers that is legitimate for Covered California. It's the only place where you can go, where a consumer can go to qualify or be eligible to receive premium assistance. That's financial help in paying for their premiums. And that financial help comes from the Internal Revenue Service. The IRS is going to send a check every single month to the plan who that consumer selects as who they want to have their insurance through. So they can go through coveredca.com. They can also call one of our service centers. The 800 number is simple, 800-300. 1506, 800-300-1506. That's the number to call to get access to somebody who will be able to talk to you in your language and be able to get you enrolled. You can also go to one of the enrollment events or that are being put on by enrollment counselors here in San Diego area. We're having them at libraries, and so you can go to coverca.com and check out which library here in this area is going to have an enrollment event where you can go in and sit down and talk with somebody in person. And you can also contact a certified covered California insurance agent. These are insurance agents who have been selling health insurance for years. They've gone and gotten certified through Covered California to sell our products, and then they can come to your home, or you can talk to them directly, go to their office, sit down and talk with them at no charge. They cannot charge you a penny more than that premium costs, and you can get enrolled through them.
Well, you mentioned the IRS, and we've been conditioned to kind of fear the IRS, but in this instance,
the IRS is your friend.
Yeah, so in this case, they're our friend here?
Yes, indeed. So the IRS is going to give folks what we call premium assistance. It's all part of the Affordable Care Act. And so this isn't something for just low income or really poor people. This is something that's going to help middle class Americans, middle class Californians, working class folks be able to get a leg up, to be able to have some help paying for insurance. Because let's face it, health insurance is not cheap. So it is not going to be cheap through the Affordable Care Act. It's going to be affordable, but it's not going to be just plain free for most people. So what the federal government is doing is saying, look, we realize this. We realize health insurance can be costly, but we don't want that to be a barrier for people to say, okay, I'm not going to do this. I can't afford it. It's just the opposite. They can afford it. And if you have a family of four, for instance, who is making less than $90,000 a year, they're going to be eligible for premium assistance to help offset that cost. Anecdotally, I've come across people with families of four where they have about $70,000 of adjusted gross income. That's adjusted. That's not their salary. That's the adjusted gross income, the money that you pay your taxes on. They come away with having $400 or $500 a month coming from the Internal Revenue Service directly to the health insurance company to help offset the cost of their premiums.
Well, good deal. Our conversation is far from over. We're going to take a short break and continue our conversation with Dana Howard of Covered California. So please stay with us.